Welcome to the Pulse Insights audio briefing. I am your automated host, Zara, speaking on behalf of Marketstrat. We are bypassing the AI hype to bring healthcare operators and investors the ground truth of imaging economics and platform architecture. This week, our data shows a massive structural split occurring across the market. In our analysis, imaging AI is rapidly diverging into two strictly defined lanes: reimbursable clinical services, and provider-funded productivity tools. Let's begin with the regulatory shockwave driving this split. Our team is dissecting the CMS Calendar Year 2027 OPPS proposed rule, and it represents a profound two-sided reset for hospital economics. On one side, CMS is proposing site-neutral, fee-schedule equivalent payments for routine, uncontrasted imaging in accepted off-campus departments. On the other side, they are proposing a targeted software as a medical service, or SaMS, payment bridge, initially designating 36 codes for separate APC payment under a new O1 status indicator. Our Marketstrat POV is that this policy forces a strategic reckoning. Routine imaging economics are being compressed into a volume-based commodity. If you are selling an AI product today, you must explicitly prove that your tool either earns this separate SaMS payment, or it directly cuts the operating cost of a completed study. So, what does a reimbursable clinical service actually look like under this new framework? Look at the cardiac sector. The competitive unit in coronary AI is no longer simple plaque measurement. At the recent SCCT meeting, Heartflow heavily pushed its plaque staging layer, supported by clinical datasets covering over 36,000 patients. In parallel, Cleerly advanced its highly configurable full-text reports, and Keya Medical officially entered the space with an FDA clearance for deep vessel plaque. In our analysis, these vendors are turning plaque quantification into a longitudinal disease management workflow. The commercial hurdle is shifting away from detection accuracy towards serial risk assessment and proving that this software staging actually changes a patient's medical therapy. Now let's pivot to the productivity and infrastructure side of the split. For these operational tools, distribution is becoming the ultimate product. This week, Viz.ai announced it is integrating Cortex.ai's NeuroQuant tools to target multiple sclerosis. This expands Viz.ai's footprint from acute, episodic neurovascular care into chronic neurodegenerative disease across its network of nearly 2,000 U.S. hospitals. Our position is that quantitative analysis alone does not route a patient or coordinate a specialist. The orchestrator who controls the enterprise workflow captures the disproportionate value. We are seeing a similar control play with CliniComp, which just cleared a diagnostic quality PACS viewer embedded directly inside its EHR. The boundary between the departmental PACS and the longitudinal patient record is actively dissolving. Finally, let's look at raw capacity release at the point of image acquisition. Philips just launched the Alturion ultrasound system in the US and Europe, featuring its auto-measure abdomen AI tool. Instead of asking hospitals to procure and integrate a separate sidecar application, Philips is bundling AI directly into the cart's user interface, achieving scan time reductions of up to 30% in controlled evaluations. For OEMs, AI is now a fleet economics play designed to standardize training, reduce sonographer variation, and accelerate room throughput. What is the strategic imperative for you this week? The Marketstrat bottom line is clear. Vendors must explicitly build a payment dossier or a distribution dossier. Providers must completely separate their business cases. A code-linked clinical analysis and a workflow acceleration tool operate on entirely different financial mechanics, and they can no longer be evaluated through the same procurement lens. That concludes your Pulse Insights briefing. I am Zara, speaking for Marketstrat. Stay focused on your operational realities, and we will catch you next time.